The following are course descriptions for the Child and Family Welfare Concentration Area for the Human Services undergraduate program at Purdue Global. HN 370, Child Welfare and Family. In this course, students will explore working with children and their families in a human services setting. They will examine how the family functions as a system, learn how to apply ethical reasoning to work with diverse children and families, and identify state regulations for mandated reporting. Students will also evaluate intervention resources relative to work with children and families and create ethical interventions to serve this population. Multiple topics are discussed, including social problems affecting children and families, the impact of poverty and trauma on children and families, the juvenile court system, the foster care system, and adoption. HN 377, Studies in Child and Adolescent Development. Students in this course will explore the various aspects of child and adolescent development, including the psychological, social, emotional, cognitive, and biological changes specific to these age groups. Students will identify milestones of development, typical and atypical behavior, and the interrelationship between the person, family, and community. Using real world scenarios, students will design ethical interventions based on theoretical and practical knowledge of development. Additional topics include the impact of child maltreatment, culture, ethnicity, peer relationships, family relationships, gender, morality, and socioeconomic status on development. HN 430, Advocacy for Families and Youth. Students will analyze the influence of biological, social, economic, and cultural forces impacting children and families. Students will be introduced to the roles and skills necessary to intervene on behalf of this population and design ethical interventions for children and families at the micro, meso, and macro levels. Other topics include exploring career options for child family advocates, legal and ethical considerations for child and family advocates, trauma informed care, school related issues, special education services, substance use and addiction issues, suicide, grief, risky sexual behaviors, prevention and intervention programs, juvenile delinquency, and youth violence.